Welcome back to this channel. My name is Joel Musando. So today we'll be discussing about HIV testing, and the objectives for the day includes. So today we'll talk about types of HIV tests. We'll talk about HIV window period, how to do HIV self-testing, and how to interpret HIV results. So before we get started, at least we should know who is supposed to go for an HIV test. Okay, so in case you are aged between 13 and 64 years, you need to know your HIV status. And in case you exchange sex with money or drugs, you need to go and get tested, because you don't know whether you don't know whether your client is HIV positive or HIV negative. If you are diagnosed with any sexually transmitted disease, or you've been treated for any STD, you need to go and get tested. Then if you are diagnosed with or treated for TB or hepatitis, you must go and get tested for HIV as well. Then if you are a man and you have sexual intercourse with another man, you need to go and get tested. And if you had a vaginal or anal sex with a confirmed case is anyone who is known to have HIV, okay? You need to get tested. Then if you have multiple sexual partners, you need to go and get tested. If you are pregnant, you must be tested. If you are pregnant, you must be tested for HIV. Never forget that. Then, if you are sexually active, whether gay or straight, you need to get tested for HIV every 3 to 6 months. Okay. So, types of HIV tests. Number one, we have antibody testing. What is an antibody? Let's say, for example, in case you are exposed to HIV, your body produces protective molecules, and these molecules are very specific. They target HIV. The molecules that your body produces in response to any infection are usually very specific. So when you are exposed to HIV and your body produces molecules that are specific to HIV, we refer to them as the HIV antibodies. So we have a test that specifically tests for HIV antibodies. So our test number one for HIV, we have antibody testing. There are two types of HIV antibody testing. We have rapid HIV antibody testing, whereby they will be using blood from your fingertip, and the test will take about 15 to 20 minutes. Then we have another antibody testing for HIV, whereby they will draw blood from your vein, and the test will take about 2 hours. It's called ELISA for HIV, okay, and it's a more sensitive test compared to the one they'll draw blood from the fingertip. Then test number two is antigen testing. For antigen testing, we have rapid antigen testing, which also takes about 15 to 20 minutes, and they will use blood from your fingertip as well, and also they can use blood from your vein to do HIV antigen testing. Then we have nucleic acid test, not exposure. That's a mistake here. Nucleic acid tests. It's nucleic acid test. Okay. Nucleic acid test, in other words, test for the presence of the virus itself in blood. nucleic acid test is also referred to as polymerase chain reaction. Okay, some people call it the HIV viral load testing. So it tells us whether the actual virus is present in your blood, and it also quantifies the amount of HIV in your blood. Good. So what is HIV window period? HIV window period in simple terms is actually the time between you are first exposed to HIV and the time that a test can detect the presence of the virus in your blood. So it's the duration between exposure and the time the virus can be detected in your blood. So HIV window period will always vary, okay, will always vary depending on the test that you are doing. So in case you do a rapid antigen or a rapid antibody test, whereby they take blood from your finger tip, and the test takes about 15 to 20 minutes, the window period for that test is 18 days to 90 days. You can only detect HIV using this test when you were exposed to the virus 18 days ago to up to 90 days. Okay. Then if you do another test called antigen or antibody lab test, that is when they draw blood from your vein, then they test for the presence of HIV antigen or HIV antibody in the lab. Okay, this will take 18 days to 45 days. So if you do a nucleic acid test, a nucleic acid test is more sensitive compared to the other tests. It can detect the virus between 10 days and 33 days after exposure. In fact, the nucleic acid test is always recommended for those people who have been exposed to the virus, they are not very sure, or people who have the early symptoms of HIV and they need to confirm. So nucleic acid test is more sensitive, so this will help to detect the virus so quickly, so that the doctor may start you on the antiretroviral therapy as soon as possible. So remember, you can go to the lab and do HIV test. You can also decide and do a self testing in your house, in your office, or in any isolated place. So you need to go and buy a self HIV testing kit from the pharmacy, and the test takes about 20 minutes. Okay, so for self testing, the sample used is a swab. So you just swab your mouth and then you wait for 20 minutes and see the results. So how do we interpret HIV results? Okay, so I'll draw something here. So let's say this is the kit. This is our kit here. So here, this is where we'll put blood. Then there's surely a line here and here. So this one is called test. Then this is the control C. Okay. This is a kit. So we want to do HIV test. Okay. So when we put blood here, so I'm discussing about interpretation of results in case you do a rapid HIV test. So you put your blood here and a buffer and wait for about 15 to 20 minutes. Okay, so we can have three different types of results. Okay, so first result, let's say this is the kit. Oh, sorry, this is the kit. Here we placed our blood here, and you've waited for 20 minutes and you've only seen a single line here at the place written C. This is a negative test. Okay, this is a negative result. This is negative. A test is negative only if you see a single line at the control, at the C here, C control line here. That's a negative test result. Then a positive test result, you will see two lines. Okay, two lines. Yeah, this is our sample. We'll see a line here at the test and also at the control. Control and test. This is a positive test result. Okay. Then we also have another result here. Result number 3. Here. This is your blood. You've waited for 20 minutes and you've only seen one line here at the test. Okay. This is an invalid result. Invalid. This is invalid, and the test must be repeated. Okay. Or see the fourth result here. Fourth result. This is your blood. Then you don't see any line at all. This is also an invalid result, and this must be repeated. So in case you do a self HIV test in your house and it turns to be positive, what are you supposed to do? You need to link up with the community health worker, or you need to go to a hospital lab so that they can conduct a confirmatory test. Okay, when you do HIV test using the rapid kits, that is not the end. You have to confirm the results. In case it is positive, you have to confirm the results with another more sensitive test. So in case you do self-test or community HIV testing, link up with the community healthcare worker so they will organize for a follow-up HIV test so that they can confirm whether you are actually HIV positive. Because remember, these kits can still give you a false positive result. So if the kit can give you a false positive result, that means it can also give you a false negative result. So in case you do HIV test and you are sexually active, you need to confirm that. That's why in a year you need to do HIV testing like two to three times a year. Okay. Then in case you do HIV test in the lab, so in the lab we have kits. Can do the rapid test, it turns positive, then we proceed and do other confirmatory tests to rule out false positive results. Okay, but we don't rule out the false negative results. In case it turns out to be negative, we just give you a negative result and you go home. So it's up to you to decide whether to repeat the results in the future or not. So that's all about HIV testing and results interpretation. So today we've discussed about types of HIV tests, and we've said that we have nucleic acid testing, which is the most sensitive. Then we have antibody testing. Antibody testing, we have two types. The one we use the venous blood from a vein, which is more sensitive than the one we use, the one that entails using the blood from the fingertips. Then we also have the antigen testing that entails using blood from the fingertip and also from the vein. So HIV window period depends on the type of HIV test that you've selected, and it varies depending on the test. So you need to know the best test that you can do for HIV testing. Then we've also learned how to do HIV self-testing, and we've also learned how to interpret results. Thank you for watching and have a good day.